Hello. Good morning, fellow friends and loved ones. Yes, it's once again a very great privilege, a great honor to come to your homes, your various workplaces, and if you're in a vehicle or the bus, it's a very great honor and privilege to continue our weekly discussions. Yes, and so last week we had a wonderful discussion, and this week also we are continuing our discussion. And last week we had a discussion on talk about skin grafting. We had an extensive discussion on it, the instrument that we use, and so many things. And we thank God for such a discussion. This week also we are having another interesting discussion. And before we begin the discussion, I want to thank you all for your time and thank you all for the opportunity given me to be able to engage us in this discussion. And also thank you very much for your prayers and everything and your support and everything. So this morning we having a discussion on topic pain in the pelvis. Pain in the pelvis, or we call it osteitis saltans. Osteitis saltans. Yes, osteitis saltans. So this is a scientific name. I'm sure it's a big name for you, but pain in the pelvis is actually a very understanding or comprehensive statement to make. Okay, so we begin this topic in the name of the Father and of the Son and of the Holy Spirit. So as we begin, what is pain in the pelvis? First of all, we know what to talk about pain. When we mention pain is actually a discomfort that occurs in any part of our body as a result of either an injury, as a result of trauma, as a result of something that's going well in our system. So pain is an indicative factor of something not going on well. And the pelvis is actually a part of the body that is responsible for keeping us in position. So the pelvis is actually at our waist region. From the waist some few centimeters down, we find our pelvis. And our pelvis is actually composed of bones, composed of muscles, composed of ligaments, tendons, so many structures surrounding this structure called pelvis. Actually, the pelvis is actually a bone. There are bones coming together to form the pelvis. The pelvis comprised of three bones. We have the ischium, the ilium first, that's the upper part, the ischium, and then the pubis. So we're talking about pubis, ilium, ischium. So when you hear about them, they are all bones: ilium, ischium, and pubis. And so you hear that you mentioned a common name called pubic symphysis. Actually, pubic symphysis is actually the point where you feel the pain. That is where the pain in the pelvis is. So the pubic symphysis is the portion where the pain is felt. So the bones are actually called the pelvis, and then the pain that is felt around the pubic symphysis. So very soon we're showing some pictures indicating the pubic symphysis, and I'm sure we will appreciate it. So what is pain in the pelvis or osteitis saltans? Okay, so actually, okay, so we are mentioning osteitis saltans to state that it's osteitis pubis. So I'm sure we understand the meaning of pubis now. Pubis is actually a part of the bone. So we have the ilium, ischium, and pubis. So when I say pubis, it means the part of the bone. Pubis, part of the bone. And then when I say ostei means bone. Osteo means bone. And itis means pain. When you say pharyngitis, inflammation of the pharynx. When you say tonsillitis, inflammation of the tonsils. When we say appendicitis, it means inflammation of the appendix. So that's just pain that is indicating that there's inflammation or swelling around the structure. So osteitis pubis, that's the topic, the scientific name, osteitis pubis. Osteitis pubis, or pain in the pelvis. Osteitis pubis. The topic is osteitis pubis, or pain in the pelvis. So when you have osteitis pubis, it means that there's a pain around the pubic region, that's the bone region, which is causing pain and inflammation. Okay, so it's actually a painful and chronic condition that is common in athletes or people who engage in athletic activity. When we say athletic activity, it means those who engage in probably sports activities, soccer, long distance running, very heinous activity that involves you to stretch your leg and open your legs as wide as possible. And the opening of your leg as wide as possible causes the stretch or the overstretch of this structure in continuation. So just imagine a footballer playing football, like our own Cristiano Ronaldo or Lionel Messi. Yes, they are all very good footballers. So just imagine continuous using every day playing football. There's a likelihood that there could be a stretch of this structure. But we're talking about the fact that males are not predominant in terms of this condition. They are not likely to have this condition. Actually, the females are likely to have this condition. So when they engage in activities such as football, female football players, they are more likely to have this condition as compared to the males. Actually, it occurs around a place, as we mentioned, called the Pubic Synthesis. That's why the name came out as Austeritis Pubis. So that's where two bones meet. So there's a point or a junction called the Pubic Symphysis, and this Pubic Symphysis actually has something we call a cartilage called the Hyaline Cartilage that helps to be able to merge these two bones together. So if these are the two bones, which will be shown in the picture very soon, these are two bones, there's a space in between called the Pubic Symphysis where we have the Hyaline Cartilage, and this is most appreciated in terms of females. That's when the woman gets, the lady gets pregnant. When it gets pregnant, there's a high probability, which occurs in most times, where the baby sits in that bone. These two bones, they are like a pear-shaped bone. So the baby sits inside and grows and becomes bigger. And this extensive nature of the baby will cause the bones or the structures to open up. And this allows the pubic symphysis to open up gradually. And most importantly, when the baby is about to be born, this pubic symphysis is required to open up a little for the baby also to come out. So it is very, very important structure that if it's injured, there's a very high likelihood that the two bones will not be able to hold themselves together, and this is actually a major concern in terms of pregnancy. So let's take note of it. And so this actually causes presentations in the person as in pain and local tenderness. When you say pain, I'm sure the patient or the person is able to express the pain himself. But when we talk about local tenderness, we have to then call something called palpation. So we have pelvic floor rehabilitation specialists who can go into the pelvic region and see whether there's tenderness there. And also, there are some tests that also we do as physical therapists to indicate whether there's inflammation or whether there's pain there, which we're talking about very, very, very soon. Okay, so as we mentioned earlier, it occurs in athletes who participate in sports, and these sports which supposed to involve twisting, pivoting, cutting, and also during sharp changes. So if you have someone doing a short put activity, he turns around and then just toes out, but even that one doesn't really push out. But someone like involving long jump, just imagine long jump runners, they are likely to overstretch this activity. Footballers and sprinters, yes, that's 100-meter sprinters. These are activities that could cause you to be able to injure your pelvis, causing Austeritis Pubis or pain in the pelvis. So some of the activities also actually are rugby and hockey. Yeah, these are activities that will cause you to have Osteitis Pubis. So we'll pause and look at some pictures, and then maybe we'll continue so that we can appreciate it as we talk about it. I'm sure we'll have a gist of it. Okay, so just a minute. Let's look at what the pelvis is. Actually, it's virtually an interesting structure. Maybe if it's in your body, you might not be able to appreciate it, but when you see the picture of it, yes, you get to appreciate it. Okay, so this is what we've been talking about so far. So this is the pelvis. So every human being, in fact, every human being, including myself, yes, we have a pelvis. So this whole structure is called a pelvis. Yes, This structure is called the pelvis, and this is called the ilium. The ilium, this bone. So we have two iliums. So ilia, we don't say iliums. Ilia, ilium and ilium, two ilia. And we have these white structures we call ligaments. They are very strong structures that support this bone from breaking away or being destroyed when there is excessive pressure on this bone. So they keep them together and hold them together. And this structure is called the sacrum. The sacrum. They are a combination of 5 bones that come together that holds the structures or organs around the side, and most importantly during pregnancy, the baby. So the baby sits here. So when you're pregnant, the baby sits here for about 9 months, from a clot of blood to conception to being born. So the baby sits in. Just a minute. So a little bit of okay. So okay, yeah. So the baby sits inside the here, this region here, and grows in and becomes bigger. So when the baby is coming out, this structure called the pubic symphysis, God has made it such a way that it can expand a little bit to allow the baby's hair to come out. If this structure was very, very strong and bony, I don't think the baby would have had enough structure. That's how God planned it, and so we thank God for that. So this structure is called the pubic symphysis. This structure, this region here, pubic symphysis, and this white structure is called the hyaline cartilage. It's a very important structure that allows at least some little movement to be able to contain the pressure around the side. And also we have ligaments here. These are all ligaments here. This actually, under this structure, this ligaments, we have the groin. I'm sure you've heard about groin before. Yeah, so the groin. So if you have groin pain, you can have around this side. When this ligament is injured, you can have pain around the side. We have our tests, a lot of tests that we do as physical therapists to be able to determine and differentiate between a groin pain as a result of ligaments or as a result of the groin itself. So we have the ilium here. The big one is called the ilium, and just underneath this one is called the ischium, and then this structure is called the pubis. So when we say pubic symphysis, actually, the symphysis, I'm sure you've heard about symphony is actually coming together. So the coming together of the pubic bones actually forms the pubic symphysis. So this region is called the pubic symphysis. So pubic symphysis, and then when there's inflammation around the side, we call it the Austeritis Pubis. That's the pain in the pelvis. Okay, so this is also the thigh bone. That is the leg bone. Yes, so you can see it here. That's the thigh bone. The head of the thigh bone is called the femur. So you have 2 femur. Every human being has 2 femur. Okay, so this is an X-ray showing the region around that side. So you can see. So most X-rays don't show the cartilage. X-rays cannot penetrate to cartilages to bring them out, but they can penetrate to bones due to the calcium nature of the bone. So X-rays pick more calcium and then they show them out, as compared to MRI that can penetrate to structures and see them visibly. CT scan also can do the similar and see detailed structures. You can have ultrasound and other structures, other machines. Yeah, so this is also a very good explanation of the condition. So this inflammation of the pelvis. So you can see the reddish nature of this structure is indicative of inflammation or pain around the side. So you can see here around the side, and so you can see and appreciate it the more. So this is the pelvic region. So when you have inflammation around this side, it can occur in both males and females, yes, but as we said initially, it occurs mostly in females due to so many factors, hormonal factors, due to the laxity of the structures as a result of pregnancy, and so many reasons. And so we can continue our discussion. I'm sure we'll have some pictures very soon to show you. So let's keep tuned as we continue our discussion. Okay, so thank you very much for staying tuned. You can also share the link to the viewers, friends, and loved ones as we continue our discussion. So what is actually the anatomy of this condition? We've talked about the bone, the ligaments, seen some ligaments, seen some tendons, we've seen some cartilages, hyaline cartilage. So these are all structures that come together. They come in symphony, they come in unity to be able to hold our whole waist region to our leg, to our to our to our lower waist region very, very firm. And this allows other organs to be seated in them so that together we can function, and we can function as a normal human being. So this actually is found in front of these structures. So the pubic symphysis is found in front of the bony structures, and this gives support. We say anteriorly, so anteriorly means in front, it gives in front, and this actually is very important structure. It stabilizes the organs in our body. We have two major important ligaments that give support to this structure called the pubic symphysis or the hyaline cartilage. It's called the superior pubic ligament and the inferior pubic ligament. These structures are very important to hold this hyaline cartilage and then other structures in place. So this a mechanism of occurrence of this condition, that's how this condition occurs, as we mentioned earlier on, when there is overstretch of this structure. So when you have too much stretch of the pubic bone or the ligaments around the pubic region, we can cause inflammation, that is minimal or micro tears around the structure region, and this will cause inflammation, pain, and could cause even loss of function or reduction or decrease in our daily activities. So just imagine if you're walking from here to the junction, or even when you're sitting in the car, you feel pain around your lower abdominal region, and then around your waist region you can feel pain around the side. So around your reproductive organ region you can feel pain around the side, and these actually are indicative of having this condition called Austeritis Pubis. So kicking too much pressure around that structure, that is around your female reproductive organ or male reproductive organ region, will cause this condition. And so we learned that we are learning that we should avoid too much stress. If you are a sport athlete or an athlete, there are various exercises that are important, and so most football clubs have physiotherapists outside, but we are catching up in terms of Ghana having physiotherapists in our various football clubs, and these are very important so that we can get our players very, very fit and there'll be less injuries. And so it's still in progress, and I think we are doing well, we are getting better. So how does this condition present clinically in our hospitals? So the person comes and says that I have pain around my reproductive organ region and it's very painful, and even when I'm going to pass out urine, I feel pain. And so we go in, the doctors go in for MRI or X-rays to be able to see and appreciate the structure of this pubic symphysis we are talking about. If there is any shift, if there is any reduction in terms of the normal size, there could be also reduction in normal size due to overuse. When it's overused, there is too much stress, and there could be even something we call osteoporosis, which is actually in aging. So when you're aged, but then this structure mostly is as a result of overuse. When you too much use of the structure, it could cause you to have pain around the side. So the pain could be located around the pubic symphysis, which you've seen a picture of it. If you want to see more, we'll be showing you more very, very soon also. And then so it affects a person's ability to close up the legs. Closing up the legs could cause pain, and even sometimes opening up of the legs also cause pain. The person could also have pain around the lower abdominal region, and then with very little movement such as walking, even crossing the legs could cause pain. These are all indicatives of having Osteitis pubis or pain in the pelvis. So then how do we diagnose this condition called Osteitis pubis? Yes, so first of all, as physiotherapists, where we have the pelvic rehabilitation specialists, there could be a very indicative and very definite diagnosis called the palpation method. So we palpate the pubic symphysis region. So if there's pain around the side, immediately we zoom into having the patient Osteitis pubis diagnosed. But then before diagnosis, we have other confirmatory tests. We can have the MRI, we can have the X-ray that will also confirm our physical diagnosis. And so we have other tests we call the Pubic Synthesis gap test. If there's any spacious or increase in the gap of the pelvis symphysis, then we can say that the person have Osteitis pubis. We have the Isometric adductive contractive test. That is when you have the patient to close the legs. The patient complains of pain by closing the legs. Also, we have bilateral adductor test. So when you ask the patient to close up the legs, pain. Even sometimes opening up could cause an increased pain. And then also the person has pain around the groin region. So we showed the groin region earlier on, which if we want, we're showing you a very quite small pictures very, very soon. We have so many tests as physical therapists, and this gives us a very definite diagnosis of this condition called Osteitis pubis. We have the positive Faber test. Faber test is actually an acronym. We have the flexion, abduction, external rotation. Yes, so these are all scientific terms that physical therapists do use to go to diagnose this condition. You can have also the person complaining of waist pain going inwards, so that is referred pain inwards into the reproductive organ region, and these all give us some clues of the fact that the person is likely to have Osteitis pubis. And so the person could have weakness in the abductor or adductor muscle, that is opening of the legs becomes difficult, even closing up becomes likely more difficult. So as we said, we can use an MRI which gives us a very detailed presentation of the structures around the reproductive organ region. This is called magnetic resonance imaging. And also we have medically we have a test we call or a device called the triple phase scintigraphy, and this actually confirms a pain around the groin region, and also it helps to exclude all other types of groin pain injury very indicative of pain around the pubic symphysis region. So this helps us to be able to diagnose this condition as best as possible. Other conditions that could look like Osteitis pubis, we have the direct inguinal hernia. If you've not heard about hernia before, yes, we have sports hernia, we have iliopsoas injury. You have so many injuries. You have ilioinguinal neuralgia, so many. And we also have a very, 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 very common condition. I would say not common, but it's actually condition that you are like to have if you have an infection. So we call it osteomyelitis, that is infection of the bone. So actually this condition is considered more common in non-athletes. That is when someone has osteomyelitis. Athletes are very active, so they are known to have strong bones, and so these are conditions that could look like Osteitis pubis, or pain in the pelvis. And so we tend to rule them all out so that we can diagnose this condition called the Osteitis pubis, or pain in the pelvis. So we look at some statistics worldwide, and it's shown that yes, this condition affects mainly people who are involved in intense physical activity, that is athletes, so those who engage in athletic activities, and they are likely or more likely to have this condition called Osteitis pubis. And actually the study carried out outside, and it's shown that yes, people who do long distance running or athletic activity have a chance of 0.5 to 0.8 more of having this condition called Osteitis pubis, or pain in the pelvis. And also in a year, it's noted that soccer players, so we have Messi, Ronaldo, Xavi, you have Mbappe, Pepe Reina, all the big names, yes, Sergio Ramos, Lukaku, yeah, this one of the common names that's coming up now. He's a very good footballer. He's now in Chelsea. These people, when you have all these people, yes, engaging in strenuous activity, they can injure their pubic symphysis and then could cause Osteitis Pubis. Okay, so how do you treat this condition called Austeritis Pubis? So we have conservative method, we have the surgical method, but as we all know, we don't go to for the option of surgery as the first option. We go to conservative method. That is where we don't go in by cutting. We treat other conservative methods such as the physical therapy method, and this helps to relieve pain also and to improve function. But then after a while, when the pain becomes chronic, then we go into surgical approach, and this surgical approach is opted for after 3 months of not having any improvement in terms of pain relief and then function or physical function. So we have a conservative approach such as the physical therapy. We do a procedure called the RICE. We have the rest, eyes, compression, elevate. So this is actually in the first week or first 3 weeks of pain complaints. That is, so when you have this pain around the pelvic region and you can't walk and you have pain, mild pain, sometimes it becomes worse in the morning, in the evening, at noon. Yes, so we need to report them as early as possible to be able to find the best solution to it. So we do rest eyes. We also give inflammatory or anti-inflammatory drugs. This helps to reduce swelling, and this helps to also improve upon function and also return to work as early as possible. So all these are to be able to resolve the pain and also improve upon the swelling and reduce the swelling. So we have actually 4 definite stages as a physical therapist that we go through. And so when the patient has this pain, we do RICE, and that is rest and eyes, compression, that is we stabilize the side and also elevate and try to raise the place as high as possible, especially during sleep, to be able to improve upon the swelling, that is reducing the swelling. So when the pain goes away, when the swelling goes away, physical activity has to begin in order to get the structural strength around the side very, very well and return to activity, especially for the footballers. As we know that football actually fetches money. So let's imagine you have one of your footballers. I don't want to mention any name because it might be on cloud 9 or be viral to mention someone's name having this condition called Austeritis Pubis. So I want to reserve my comments or my names in mind. Yes, so someone having Austeritis Pubis, you might lose thousands and millions of dollars or euros. Yes, so we want to return the person to activity as best as possible. So we go to active exercises, so open up, close up, then gradually go into using of a gym ball. So we have a gym ball that is soft in nature. The patient sits on. There's some raising leg exercises and so many complex exercises, but they are gradual. So after some time, the patient moves on to probably a mild treadmill activity to be able to strengthen the structure, and also goes to cycling, and then gradually starts jogging, and then returns to activity. So these are all stepwise procedures as physical therapists go, and then ensure that the patient, especially the athlete, returns to activity as early as possible. Then when all odds seem or prove futile, then we return to or resort to surgery, and this actually begins deliberation begins 3 months after nothing or no improvement is seen with conservative approaches. So then we noticed that about 5% of or 10% of patients actually resort to this procedure called the conservative approach. Yes, so 5 to 10% of the patients do not resort to conservative approach. So a majority of them actually do the physical therapy, the rest and eyes, the elevation, the minimal activity, and then the return to function. But then 5 to 10% of them do not resolve in terms of pain. So then they have to go through surgery to be able to resolve the pain. So what are some of the lifestyle modifications? That is what we can do to be able to minimize the pain. So also we need to exercise. So there are specific exercises that, as we said, as physical therapists, we are supposed to teach the athletes or individuals who are involved in overuse or continuous use of these structures. So this helps to maintain their function and also return to activity or improve and maintain the activity. So as athletes, they have something called warm-up exercise and cool-down exercises. So this helps to strengthen or send blood around to that side. And notice that blood contains food. So when you have blood around the side, you're able to nourish and strengthen the structure, the pelvic symphysis, pubic symphysis, and this helps also to give the patient enough strength for that activity. Okay, so we've said so many things. We'll be looking at some of the pictures. Then now we move on to the next topic for next week. I'm sure you've seen the flyers for next week already. So we'll show you and tell you the topic. If you've not seen it, we'll tell you the topic very, very soon. So now let's move on to the pictures. Okay, so we're continuing from where we ended from the pictures. Okay, so just a minute. Okay, so these are the pictures that we were talking about. So this is the pubic symphysis. So this structure is called the pubic symphysis. This is the cartilage called the hyaline cartilage. The hyaline cartilage. Okay, so I hope you can see it. Okay, so yeah, so this is the hyaline cartilage. This is the structure called the hyaline cartilage. Here, this is cartilage, and this is a pubic bone. And so this is also a very, I'm sure this is more extensive, and you can see it very clearly here. This is the pubic symphysis, and this is actually the bone growths around the side, and then it could be, we call it osteophytes going around the bone, piercing out, and this could be as a result of, we call it hypercalcemia, too much calcium. That is when the person is an athlete and does exertive activity. So this is also an example. This is the pain around the side, the pelvis. So this is a pubic symphysis. This is the hyaline cartilage. So during birth, it tries to open up a little to allow the baby to come out. So this is an X-ray indicative of the pubic symphysis. You can see there's some abnormal presentation around the side as compared to this side. This is actually loss of calcium around the side, and this, if you have some condition we called osteoporosis, you can have this condition called Austeritis Pubis. And these are another X-ray. You can see the pubic symphysis has opened a little. So when you have probably a trauma around the side, you can have the injury around the pubic symphysis, and this could cause the gap between these structures to increase, and this could be very serious. Yes, and so this is actually the athletes trying to kick a ball. You can see it. So when the athlete overstretches the structure here, you can have micro tears around this side. So this is a zoomed in structure around this side. So you can have too much stretch around this side, and it could cause inflammation of this structure called the hyaline cartilage. So the patient could complain of pain around the groin region and go into the reproductive region. Yes, so another picture here giving us a better description of the condition, that's pain around the side. So these are some of the structures that are actually concerned with pain around this structure called the pubic symphysis. So you can have around the buttocks region, around the inner thigh region, you can have around the organ region. And so this is called the Osteitis Pubis. So when you have the pain around this side, you can have Osteitis Pubis. So this is also an example of the picture. Yes, so this also another one here. So this is another one here. So this is the muscles around the pelvis region. You have the pubic symphysis. You can see there the pubic symphysis composed of hyaline cartilage. This is a pubic bone. You can see here, this is a pubic bone. This is a pubic bone. Yes, so you have two pubic bones coming together at the junction called the pubic symphysis. Okay, another X-ray of indication of the pubic symphysis. As we said, the hyaline cartilage is not captured under the X-ray because it doesn't have too much calcium to pick up the structure. So we have MRI that can really pick up the hyaline cartilage. You will to see a very detailed form of this structure. This is also the hyaline cartilage. You can see there's quite some reduction in the pubic bone space, and so this is another one here. Okay, another one here. So these are the muscles that surround the pubic bone. They hold the pubic bone together. So when you're kicking the ball, you can control the force. And this is the pubis, and this is the ischium. So pubis. So this is ilium, ischium, pubis. So ilium, ischium, pubis. So IIP. Ilium, ischium, pubis. Let me project it very clearly. I'm sure you can see it clearly now. Ilium, ischium, pubis. Ilium, ischium, pubis. You can see a very detailed structure of the anatomy here. So these are structures we have to appreciate. And this is actually the sacrum, where the baby sits. And this is the coccyx, the tailbone. It's around this side. And we have the pubic symphysis around this structure here. Okay. So let's look at some few pictures more. This is actually an explanation of what we're talking about here. This is an MRI giving the details. So you can see the pubic symphysis here. You can see it here. It's an MRI. You can see it here. A very good presentation of this condition, pubic symphysis. Okay. So this is also another one here. The pubic symphysis. The X-ray. Another X-ray. Okay. So I think we've done a lot. This is an X-ray. Okay. So yes, we've learned a lot. And thank you very much for your time. And it's been a wonderful time. We've learned a lot. In fact, myself, I've learned a lot. I hope you have some questions. You have some questions, but then if you have any questions, on our Facebook wall, you can ask questions, and we will be very, very grateful to answer you. But for the morning, it's 10:08, and we are very grateful for us 10:08, and I'm very grateful for the opportunity given me to lead in the discussion. So next week, the 1st of September, we're having another discussion on a topic called snapping hip syndrome. So I'm sure the topic is very, very, very weird, but then we will have a lot to discuss about snapping hip syndrome. The scientific name is called the coxar sultans. Have a blessed morning. May the good Lord be with us all. Good morning and have a blessed midweek. Take care. See you. Bye.